Hello and welcome to the Practice Site Verification Form tutorial. I'm Dasha with CalHealthCares, and I'll be going over the Practice Site Verification Form, also known as the PSV, with you today. CalHealthCares was pleased to introduce this form early in 2024 to replace the prior Employment Verification Form, also known as the EVF. We consolidated multiple versions of the prior forms into one physician and one dentist form to help streamline things. The same form can now be used for applications, awardee updates, as well as awardee semi-annual and annual reviews. We updated the name to Practice Site Verification to emphasize that a separate form is needed for each practice site, even in cases where multiple practice sites are part of one larger organization with the same employer. I'll be referencing the physician PSV throughout this video and point out any differences between the physician and dentist PSVs. This form needs to be completed for each practice site location that you, the applicant or awardee, provide direct patient care at. If you're working on one campus but in different buildings, this counts as one location. But if you're working under the same umbrella organization that has different locations, a separate PSV needs to be completed with the data specific to that location provided on each form. It needs to be specific to you as the provider and not the overall organizational data. If you own the practice site, you may complete and sign the form on your behalf. We'll go over what the signature notation would look like for this scenario. Awardees who are independent contractors or employed by an organization must have their direct supervisor or designated staff with authority complete and sign the form for each practice site. Designated staff with authority includes human resources officer, manager, or specialist, a chief or assistant chief, supervisor, chair, director, practice administrator, manager, president, CEO, and so forth. All questions on the form are required unless otherwise indicated. An incomplete PSV will cause delays in processing, and we want to be able to process your documentation as expediently as possible. The PSV form can be found on our webpage, calhealthcares.org, under Awardee Resources General. There's a dentist and physician version, and we also have an instructional guide. You can also log into your Smart Simple portal at phc.smartsimple.com. Scroll down to the progress reports and click on the review that you want to submit. And you can download the PSV form from the Practice Site Information tab. Okay, so let's dive in. Check the box at the top of the form to designate the intention of the form. So for example, for applicants, you would select application. For awardees, there are 3 different types. Awardee update forms are relevant for a change in practice site. For example, transitioning to a new job or adding an additional practice site, or a change in practice site details such as a change in hours. Please note, if your transition between your old and new job exceeds 30 days, you need to submit an extenuating circumstances form to document the gap of employment. Timely notification within 10 business days is important. With any change to practice site, it is your responsibility as the awardee to ensure you will continue to meet program requirements. If you are experiencing any challenges, please reach out to us. There are also semi-annual review forms for the 6-month mark and annual review forms for the 12-month mark. A PSV should be completed for each site you provided direct patient care at during the corresponding review period. For reviews, you will also be asked to manually enter some of the data from the PSV to the electronic form on Smart Simple. Throughout the PSV, you'll notice that several fields are noted for specific types of submissions. For example, applicant-only questions are not required for awardees. For awardee update PSVs, For a change of practice site, for example, you do not need to include the Medi-Cal encounters, as indicated in this text here. All questions are required unless otherwise indicated with these notations. An incomplete PSV will cause delays in processing. You would then input your full name, signature in blue or black wet ink or DocuSign, and date. Going back to the signature for a moment, what this means is it could be a scanned copy of a wet ink signature or a DocuSign signature, which is the only accepted electronic signature. PDF signatures, for example, would not be sufficient. By signing, you are authorizing the release of employment information as it pertains to meeting your program requirements. And then you would input your exact review period. This review period only applies if you're an awardee submitting a semi-annual or annual review. And I will show you here in a moment where you can find your review period. So once you're in Smart Simple, you can go to the top of the form where it says review period start and end. It'll tell you the exact dates, and these exact dates should be entered into the review period field on the PSV form. So this area. This is important because if your organization pulls data for the wrong review period, they will need to repull the data to match the review period on file, and we want you to avoid doing that extra work. After you've completed the top portion, you would route this form to your direct supervisor or designated staff with authority to fill out the shaded area, which is most of the form. Examples of designated staff with authority are included on the bottom here. The first part asks for your practice site full name, address, and telephone number, as well as questions specific to you, your start date, end date if applicable, and job title. If you are currently working at the practice site, the end date field may be left blank or notated as currently employed. If you are the owner of the practice site, you may indicate this on the job title line. As an awardee, if you stop providing direct patient care at a practice site during your review period, it is recommended that you work to collect the relevant data for your review, including this PSV document, prior to your departure. This will assist in minimizing delays in processing to ensure you have the data you need and continue to meet program requirements. The next component is the hours, starting with your total hours and then segmenting into the 4 subcategories of hours below. I will highlight these in orange. These are direct patient care, direct supervision, indirect supervision, and other hours, with each subcategory defined on the left. The hours indicated in these 4 subcategories must equal the total hours listed above. One thing that we often see when we're getting these forms back are duplicative values for direct patient care and direct supervision, and I'll circle this for emphasis. So if your total hours are 40 up here, then your direct patient care and direct supervision below shouldn't be double counted as 40, because we would interpret that as 80 total hours. The subcategories are exclusive of each other, and even though the combined hours of direct patient care and direct supervision are both accounted for when evaluating if you're meeting your designated hours, they should still be reported separately for tracking purposes. So let's say that you work a total of 40 hours at your practice site, and half of your time is spent with direct patient care and half of the time is spent providing direct supervision. you would provide 20, you would input the 20 hours for direct patient care and 20 hours for direct supervision. And together, these would equal up to 40 hours. So they would equal up to these total 40 hours. And they would also, this 40 hours would also count towards comparing if you're meeting your designated hours. The hours should be averaged on a weekly basis. For semi-annual and annual reviews, your hours may fluctuate widely on a week-to-week basis, which is quite common for our awardees. In this case, you can add up the hours you worked during the review period and then divide the sum by number of weeks in the period to obtain your average for each subcategory. If this is an awardee update PSV, you can input the current weekly hours you are working or anticipating. For application PSVs, please calculate the average for the prior 12 months. Ensure the numbers are firm numbers and not ranges for all of these scenarios. Please note, if your combined hours of direct patient care plus direct supervision across all practice sites fall below 32 hours of the direct patient care, you will need to complete an extenuating circumstances form, commonly known as the EC form. For temporary reductions, the time frame should be notated, and any permanent or longer-term reductions below full-time status are subject to an award proration. For patient encounters, your supervisor would indicate the total patient encounters and then how many of those encounters were Medi-Cal in the line below. For semi-annual and annual reviews, these counts should be pulled for the exact review period as listed above. For application PSVs, it's for the past 12 months at this practice site. The encounter fields are not needed for an awardee update PSV because you wouldn't have that data yet. For physicians, Medi-Medi dual eligible encounters, meaning Medicare plus Medi-Cal, do not count towards the patient caseload. This is one key distinction from dentists who may include Medi-Medi encounters towards their Medi-Cal caseload. Then your supervisor would input the Medi-Cal caseload percentage based on these numbers by dividing the Medi-Cal encounters by the total patient encounters. This number can be estimated for awardee update versions based on what your individual caseload is anticipated to average at that practice site. For applicants and awardee reviews, this data serves as a verification for current caseload, and for awardee update PSV forms, the percentage helps to gauge whether awardees are on track with meeting program caseload requirements. Question 5 is for applicants only and asks how the percentage was calculated for the caseload. So for example, you may have patient panel or payer mix, and the explanation must include specific data points as well. So for example, if your method is patient panel, then you may have 200 Medi-Cal patients out of 300 total patients. Those details need to be listed in the explanation here. And number 6 is the applicant or awardee involved in another loan repayment program. This question applies to both applicants and awardees. And if the response is yes, more detailed information is needed. Please note, enrollment in PSLF or an income-based repayment program are not disqualifying for CalHealthCares. If there is a situation where a payoff occurs while you're enrolled in CalHealthCares, let us know within 10 business days so we can assess accordingly. Number 7 asks if the applicant or awardee is currently under a performance improvement plan. If the response is yes, more detailed information is needed. Number 8, the language question is for applicants only. If you utilize other languages at work in addition to English in patient care interactions without the use of translator services, the specific languages should be listed here. Next are the acknowledgement and attestation statements. Please note, These have been condensed into one section, and no additional initials are requested on other areas of the form. Your supervisor or designated staff with authority would sign here with blue or black wet ink or through DocuSign, which is the only form of acceptable electronic signature. They would then input the date, their full name, and relationship to applicant or awardee. If you are the owner of the practice site and completing the form for yourself, you would input self in this relationship to applicant or awardee field. If you have questions about completing this form or about submitting a required document, there's a couple different ways that you can reach out to us. Awardees can email their corresponding awardee inbox, and applicants can email CalHealthCares at phcdocs.org. Please allow up to 3 business days for a reply, and email is the preferred method of communication. We also have a phone number that you can reach us at, and we also recommend going to calhealthcares.org for a plethora of resources to help you.
Thank you so much for staying on and following along with this video. Hopefully this makes the completion of the PSV form a much smoother process for you. And I also just want to take a moment to thank each and every one of you from the bottom of my heart for the service you are providing to the underserved patients in California. Thank you.